When most women hear PCOS, they picture someone overweight, covered in acne, and having irregular periods, maybe even struggling with facial hair. That's the image conventional medicine gave us. But here's the truth. You can have PCOS and still be thin. You can have PCOS and still get a period every month. You can even have PCOS and still ovulate. The problem is conventional medicine only recognizes one or two versions of PCOS, so thousands of women fall through the cracks being told you are fine or it can be PCOS when something deeper is going on. If we haven't met, I'm Elena. I'm a certified nurse practitioner and an Institute of Functional Medicine certified provider. I was trained in practice over a decade in the conventional medical model. I believed in protocols, procedures, and checklists, but when my husband and I went through IVF, I realized firsthand how little curiosity there was around why we were not getting pregnant. No one stopped to ask what was driving it. That experience completely changed the way I practice, because I saw how many women just like me are pushed into fertility treatments without ever being told what's truly happening inside their bodies. Here's the thing, there are actually more than 10 different types of PCOS, but I want to walk you through the 5 most common ones so you can finally understand why your body behaves the way it does and why fertility treatments often fail when we skip the root cause. I have a lot of patients who come to me with high AMH. A few months ago, a patient came to see me and she had AMH of 9 at the age of 30. AMH at this age should be not greater than 5. She had regular periods, so her doctor said it could not be PCOS. After 2 IUIs that went nowhere, her fertility provider recommended IVF. That's when this patient Googled functional fertility in Houston, Texas and found me. When I looked deeper, we found insulin resistance, high DHEA, which is high androgens, cortisol disbalance. It was all there. She had what I call metabolic PCOS, not the classic kind that we see in the textbook. And when we started working together, within a few months of balancing her blood sugar, supporting her adrenals, and calming inflammation, her cycles improved and she got pregnant naturally. Here's the thing, she's not the only one. I've had more than one patient with almost exact same story. High AMH, normal ovulation, multiple failed IUIs and IVF cycles, all because no one stopped to look at the underlying patterns. Once we address the root cause, the body finally starts responding. That's why I love functional medicine. PCOS is not a single clinical picture. It's a whole spectrum. Before I walk you through the types of PCOS, I just want you to know that I work with patients both online and in person at my beautiful clinic here in the Woodlands, Texas. So wherever you are, if you want to dig deep into your hormones, metabolism, or fertility from a functional medicine perspective, we can do that together. And if you love learning why your body does what it does and how functional medicine can help you balance your hormones, optimize your health and get pregnant, please subscribe to my channel so you don't miss these deep dives lessons. All right, so let's talk about the 5 most common types of PCOS. And as you listen, start thinking which one sounds like you. The first one, type 1, the classic PCOS. These women have high androgens, irregular or absent ovulation, and cystic looking ovaries. And these women are often overweight. This is the standard type doctors learn about in medical school, but it's not the only one. Type 2, hyperandrogenic and ovulatory PCOS. It means that they don't have ovulation and they have very high androgens. Because they have high androgens, these women will have facial hair. They may have hair on their nipples. They may have acne on their face, on their back. On paper, everything looks fine, but ovulation just doesn't happen consistently. Type 3, ovulatory PCOS. This one fools everyone. You're ovulating, you have regular cycles that look normal, but the quality of the ovulation is just not there, and you have high androgen. These are often my AMH of 9 patients. Lots of follicles, but eggs that don't always mature well. This is one of the reasons why IUIs and IVF stim cycles can be disappointing if we don't fix the underlying imbalance first. Type 4, non-hyperandrogenic PCOS. We don't have high DHEA or testosterone here, but still have irregular cycles and polycystic ovaries. This type of PCOS is often linked to inflammation, thyroid issues, or adrenal dysfunction. Basically, your body is under stress and your ovaries are the first to respond. Type 5, metabolic or obesity-driven PCOS. This is the one that's becoming the most common, that I see a lot in my practice. Insulin resistance drives high testosterone and estrogen, leading to acne, irregular cycle. These women are told that you just need to lose weight, but it's not that easy for them because it's not the lack of willpower, it's the metabolic chaos that they live. If this is making you rethink your own labs or your fertility journey, hit subscribe. I share content every week that helps you understand your hormones, your fertility, and your body through the functional medicine lens, not the pharmaceutical one. Here's your homework. Pull out your lab results. Look at your AMH, LH to FSH ratio, fasting insulin, DHEA, free and total testosterone. Those numbers already tell so much about why you might be struggling with infertility. And if you don't have those numbers, please tell your provider to do a proper workup on you before labeling you under unexplained infertility category. You are not broken. Your body is communicating, sometimes whispering, sometimes screaming that something deeper needs attention. Once you understand your unique pattern, you can finally stop fighting your body and start working with it and finally get pregnant. If you're ready to discover your own PCOS type and get a plan that supports true hormonal balance, not just symptom control, check the link below or reach out to me to work with me, because your fertility journey deserves more than a protocol. It deserves a personalized approach.